Hello again, everyone. You're joining us for another episode of Executive Platform's Blueprint Podcast Series. My name is Jeff Mix. I'm Head of Content and Research. My guest today is Hari Pujar. He's from Tessera Therapeutics and Flagship Pioneering. We're going to be having a conversation about the future of medicine. I think it's going to be a fantastic conversation. Hari, thank you so much for joining me today.
Thank you, Jeff. It's a pleasure to be here.
Why don't we start off with some of the things that most excite you right now in the space? I know you have a window into a lot of things our audience would be excited about. What do you want to share with us?
Yeah, that's a great question, a broad one as well. I think if we kind of zoom out a little bit, and this is the way I try to simplify the story a little bit. You know, we've done small molecule medicines for over 150 years. We then got on to the journey of protein medicines about 40 years ago. Remember, small molecules act on proteins inside the body. So the next logical step was protein medicines. And protein medicines now are just a very solid platform in the whole pharmaceutical industry. Proteins come from RNA. So the next logical step was doing RNA medicines, and we've done that with RNAi and messenger RNA. And then RNA comes from DNA in the cell, so DNA would be the next logical step. And we've been trying to get to the DNA medicine space now for a few years with gene therapy and then cell therapy. And then what we are also now doing is combining these different modalities. For example, we combine small molecules and proteins. They're called antibody-drug conjugates. We're combining proteins with RNA. They're called targeted RNA therapies. And we're doing a little bit of everything now. I think what has me most excited is the world of nucleic acid medicines. As I mentioned, it's kind of the logical next step to protein medicines, RNA and DNA medicines. We already saw the power of nucleic acid medicines during the COVID pandemic. We all have been vaccinated with an RNA vaccine. But the total amount of reach of these RNA medicines is still relatively small compared to proteins and small molecules. As we march into the future, 10 years, 20 years from now, I think it's very logical to expect that the impact of these nucleic acid medicines will continue to grow. And the beauty of nucleic acid medicines is that the mechanism of the medicine is embedded in the molecule. It's like a software code. What it needs to do in the body is embedded in the molecule itself. The trick, of course, is to get this molecule to the right place in the body. So we're now making a lot of advances in delivery of these nucleic acid medicines. And so I'm very excited about the prospect of where this could take us.
So I know a lot of our audience are in the technical operations space. They work in CMC. When we're talking about the future of medicine, I know there are exciting conversations happening about how we're going to make this, how it changes the way our supply chains work, how it changes some of the decisions we make about where we build things and when we build things. Can we talk about that a little?
Absolutely. The making of these medicines is also what makes it even more exciting. Small molecule medicines made using traditional organic chemistry, and we've mastered that to a great degree. And then we moved on to biologics, and biologics initially were very hard to manufacture. But over the course of the 40-year period that we've been at it, we've now made the process of manufacturing proteins easy as well. Then we got into cell and gene therapy, and suddenly the brakes came on. Cell therapies are individualized, which make it even more challenging. But both cell and gene therapies are really difficult to manufacture. In the case of gene therapies, you're making a virus, and a virus is a multi-protein assembly that encases a nucleic acid. It's really difficult to make. And cell therapies are individualized, which makes it even more challenging, like I said. But as we think about nucleic acid medicines, which will address cell and gene therapies, but using non-viral and, say, in vivo technologies, what we focus on is making an RNA or a DNA and then putting it in a delivery vehicle such as a lipid nanoparticle. The manufacture of these is far more simplified than what they're competing with, or what they're replacing essentially, which is a traditional cell and gene therapy. Making of an RNA, which was difficult about 10 years ago, has now been industrialized thanks to the pandemic. In some ways, we're now making RNA in very large quantities. On the other kind of RNA, the RNAi, siRNAs, and ASOs, they're also manufactured at very large scale now. They're chemically synthesized, but now there are advances where now we can manufacture these oligonucleotides enzymatically as well. So both mRNA and oligonucleotides we can now make enzymatically, which makes it highly amenable to large-scale manufacturing. And then as you think about the delivery vehicle, say a lipid nanoparticle that we all got vaccinated with, those are also eminently manufacturable at very large scales, because this is a physical process that you're relying on, as opposed to a biological process as a virus production relies on. And so both of these are very amenable to large-scale manufacturing, borrowing techniques from both biologics and small molecule manufacturing. And the QC of them, which is, of course, cannot be forgotten, is also eminently kind of scalable, so to speak, because, again, you're relying on next-gen sequencing, for example, and there have been great advances in that space to allow for very facile QC of these products.
I mean, it's exciting and it all sounds very positive, but I do want to take a moment and talk about the challenges and bottlenecks still to be overcome, because I think medicine is advancing at the rate that the people who make medicine can move forward, and there are some constraints that we're now talking about. Let's explore some of those.
Yeah, I think the biggest challenge for nucleic acid medicines is delivery. As I mentioned, these nucleic acid medicines have the mechanism built into the molecule. And so they work as intended, unlike a small molecule where, there's a lot of guessing game and, you have to find the needle in the haystack, so to speak. But the challenge with the nucleic acid medicine is to get it to the right place in the body. Now, there are some places in the body we can get to rather easily. We got a vaccine, intramuscular injection, very easy. We're now able to also deliver these nucleic acids to the liver, which is an organ that is easy to access. And many diseases have now been addressed or are being addressed with that kind of delivery. But there's the rest of the body to explore. And I think delivery is by far the biggest nut to crack. And in fact, we at Flagship just launched a company called Mirai Bio that focuses entirely on solving the delivery problem in nucleic acid medicines.
Fantastic. There are so many breakthroughs out there, and I'm privileged to be able to sit with people who are really advancing the future of medicine. But of course, anything new is expensive. I mean, you're putting the R&D in, you're getting it to work once, you're proving that you can repeat it at scale, you've got to build new facilities, maybe even new ways of assembling things. And I think a lot of what we're talking about now is, okay, we've got it to work, but we need to be able to make it at a cost that people can afford. Can we talk about cost control in the future of medicine?
Yeah, certainly. We've had breakthroughs in cell and gene therapies in the last few years, and one particular medicine that I'd like to highlight is Carvykti, a medicine that Janssen distributes. It's more than 95% effective in cancer. Remarkable. The challenge, of course, is that many of these novel modalities are difficult to manufacture, and they're also expensive as a consequence. And so how do we tackle this, right? That's your question. I think as people developing medicines, we're going to have to tackle this, because there is no way that the health system is going to be able to handle the cost of these medicines. Now, I always try to highlight the fact that there is the cost and then there's the price, and there are two different aspects. The cost is the cost of producing the medicine, and the price is what a manufacturer actually assigns for the medicine. And some of that is determined by the cost of manufacturing, but it is also determined by how much you're avoiding in terms of cost to this health system by introducing this medicine, i.e. The health economics associated with a new medicine introduction. What cost avoidance there is by introducing this new medicine into the system. But let's focus on cost for a second. On the cost side of the equation, I think because these novel modalities of cell and gene therapy have been viral and ex vivo, they tend to be very expensive. So if we go down the path of a non-viral based delivery and an in vivo medicine as opposed to an ex vivo medicine, in other words, you directly put the medicine into the body of the patient rather than take the patient's cells from the patient into a manufacturing facility, manipulate it, and then bring the modified cells back to the patient. That's a very laborious and expensive exercise. So if we go from viral to non-viral, ex vivo to in vivo, we have this great promise of reducing the cost significantly, perhaps by orders of magnitude.
Wow. So I know we don't have a ton of time left, but I do also want to talk about some of the skills that are needed in the workforce to advance these new frontiers of medicine, because it's not the way it was 10 or 15 years ago. It's what we're going to need for the next 10 or 15 years. Talk to us about the skill sets required.
Yeah, it's an exciting time to be in the industry. I wish I was starting over in terms of my career, because there is just significant advancements in so many fields that are converging to make this exciting future for us coming up. I think in terms of skills, we've been trained in either chemistry or biology or engineering or computer science. I think the convergence of that has already started to occur, but I think as we go forward, the convergence of multiple skill sets is going to be very important in the new workforce. I mentioned gene sequencing, for example, and we leverage that in multiple ways in manufacturing and QC. And so the ability to understand genomics, the ability to analyze data, large quantities of data. We have AI and ML touching every aspect of what we do. And so appreciation of what AI can do for you can really transform one's ability to advance the field. So I think people who are traditionally trained ought to now understand the emergence of new fields like ML and AI. I mean, I'm stating the obvious here, but really it's a cross-disciplinary understanding that will really propel us forward. I think the people that can integrate diverse fields are going to be the most valuable going forward.
We've covered so much in this conversation. If there were one or two things that you would like to highlight for people and have them think about a little further as we wrap up, what would you want to underline for them?
Yeah, I think if we look back the last 50 to 70 years, we've had this trend line, which has been described as Eroom's law, where the number of drugs you get with $1 billion of spend has come down every decade on a log scale. So it's a scary prospect for our industry. This is in contrast to Moore's law.
I was just thinking of Moore's law, yes.
Exactly, where it's the other way around. And, that's not a great trend line for the industry. So as an industry, we have to break this trend line. And I think we're making good progress with these new modalities, where the translation of a novel discovery in the laboratory into the clinic is now shortening. And we're now, as I described previously, using modalities that are lower cost. I think these two things will get us to a point where we break this trend line. But it's imperative that we do so. Otherwise, we're staring into an unsustainable future.
Well, I think that's a terrific note to wrap things up on. Hari, thank you so much for your time today. I feel like I've learned more in the last 20 or 30 minutes chatting with you. I've been doing this event for years, and you have a very clear way of explaining it. Thank you so much for your time.
Well, thank you for the opportunity, Jeff.
You've been listening to another episode of Executive Platform's Blueprint Podcast Series. I've been Jeff Mix. Let's do it again soon.